Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Open knee surgery. Introduction. Over the last few years, knee injuries have become more common because people are exercising more frequently. Treating these injuries may involve an open knee surgery. If your doctor recommends open knee surgery, the decision whether or not to have surgery is also yours. This patient education module will help you understand better the benefits and risks of this surgery. Anatomy. The knee joint joins the thigh bone to the lower leg bone. The bones included in this joint are the femur or thigh bone, the tibia, one of the lower leg bones, and the patella, a floating bone that gives the knee its round shape. These bones are covered by special tissue called cartilage or meniscus. The smooth surface of the meniscus allows for smooth, painless movement at the knee joint. Ligaments connect the bones and help stabilize the knee. Symptoms and their causes. Arthritis or inflammation of the joint causes the surfaces to become rough. Injury to the knee can cause meniscus tears. The ligaments may also rupture. The patella also may become unstable so that it moves out of its normal alignment. Any of these conditions can cause severe knee pain and inability to walk. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Alternative treatments. Patients may try anti-inflammatory medications such as aspirin or ibuprofen to decrease the inflammation in the knee. Physical therapy may help keep the joint as mobile as possible. Physical therapy can also help prevent further injury. The use of a knee stabilizer may also help. Injections of steroids or hyaluronic acid in the knee joint may help the pain and reduce the inflammation. For overweight patients, losing weight reduces stress on the knee. Patients may lose weight through a low-fat diet. Nutritional supplements such as glucosamine and chondroitin may help slow down joint deterioration. These are substances found in cartilage. Check with your healthcare providers if supplements are good for you. Careful, regular exercise may also reduce weight. If the pain becomes disabling and does not respond to the medications and physical therapy, open knee surgery may be considered. Surgical treatment. The operation allows the surgeon to look inside the joint and fix the exact problem. The operation is done through a large incision in the front of the knee. If a tear in the meniscus is found, your surgeon can either remove the part that is torn or repair it, depending on the extent of the injury. If a small ligament tear is found, it could be repaired primarily, that is, without additional tissue. If the tear is very significant, the ligament may need to be reconstructed using a nearby muscle tendon. If the cartilage surrounding the knee joint or patella is very rough, it can be shaved off or burned away with a laser. If part of the cartilage is floating free in the joint, it can be taken out. At the end of the operation, the incision is closed. Some patients go home the same day of the operation. Others stay a day or two. Ask your surgeon whether your procedure will be outpatient or inpatient. Risks and complications. This operation is very safe. There are, however, several possible risks and complications which are very unlikely but possible. You need to know about them just in case they happen. By being informed, you may be able to help your doctor detect complications early. The risks and complications include risks related to anesthesia, risks related to any type of surgery, and risks specific to this surgery. Risks of general anesthesia include nausea, vomiting, urinary retention, cut lips, chipped teeth, sore throat, and headache. More serious risks of general anesthesia include heart attacks, strokes, and pneumonia. Your anesthesiologist will discuss these risks with you and ask you if you're allergic to certain medications. Blood clots in the legs can occur due to inactivity during and after the surgery. These usually show up a few days after surgery. They cause the leg to swell and hurt. Blood clots can become dislodged from the leg and go to the lungs, where they will cause shortness of breath, chest pain, and possibly death. Sometimes the shortness of breath can happen without warning. It is extremely important to let your doctors know if any of these symptoms occur. Getting out of bed shortly after surgery may help decrease the risk of blood clots in the legs. Some of the risks are seen in any type of surgery. These include 1. Infection deep or at the skin level. 2. Bleeding either during or after the operation. 3. Skin scars that may be painful or ugly. Other risks and complications are related specifically to this surgery. These, again, are very rare. However, it is important to know about them. Organs around the knee that are close to the surgical area may be injured. However, these injuries are very rare. Arteries and veins going to the leg may be injured. Nerves going down to the leg may also be injured, causing leg weakness or decreased sensation. The pain may not be relieved by this operation. It may even become worse than before surgery. However, this rarely happens. After the surgery,
some patients go home the same day of the operation. Others stay a day or two. Ask your surgeon whether your procedure will be outpatient or inpatient.
You will need to keep your leg elevated when you are not walking. You may also be given a knee immobilizer or a crutch to use for a short period after the operation. Physical therapy may be necessary after the operation to rehabilitate your knee.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Damage to the knee can happen in the bones, the ligaments, or in the meniscus. If the damage is bad enough, open knee surgery can be a way to find out what kind of damage has been done and to repair the problems. Open knee surgery is very successful in helping to decrease your pain and to improve your quality of life. This operation is very safe with good results. However, as you have learned, complications may happen. Knowing about them will help you detect them early if they happen.
Thank you for using Explain.